First, really thanks a lot for coming over here and talking to us
You're welcome.
at the Pulse. We appreciate it. And I don't know if you could first just tell us a little bit about your business, you know, where it is and what you do. And
we have a small business in Durham, North Carolina. It's a hair and tanning salon called Hairport of Durham Incorporated.
Right.
Been in business since 1986. I think of small businesses as health insurance is punching bag.
The problem is that what are some of the problems you've been having with health insurance?
I mean, every year it's been an increase of 20%, 25, 30, 18 and a half. And you know it's coming in. You dread those premiums. You won't even look at them for a month until you've got to deal with it. And you open it up and you just can't believe it.
So they're just going to raise rates on you.
Oh yeah, they know
what.
you can't fight them back. You're too busy working trying to pay your premiums to fight them back. And then it's pathetic, and that's the best job the insurance companies can provide for us. They failed at their job. And most of the employees, they think they've got a good policy, then when it's time to use it, they realize it's a dud. And then they go back to the owner of the company and say, hey, I've been paying my half of the premium, I'm getting billed for this. And the next thing you know, you got to get on the phone and deal with this. Now, I've had friends in my same predicament, and they've lost their businesses because of it, or they've had to let people go. And then if you let someone go that's got problems, that creates a whole other problem for them, because if they got pre-existing, unless they go to another group, they're going to be in big trouble.
So what do you think about North Carolina Blue Cross spending money to oppose health reform?
It's totally expected.
Right.
That's their cash cow. They've got so much money they don't want to give it up.
So what do you think should happen? Tell me what you think should happen.
I think a private insurance company should be banned. We need private health insurance is like we need lead paint. They're dangerous, they are hazardous, and they're outdated, outmoded. We don't need them. They've convinced us that we need them. But if you listen carefully to what they're saying, they don't do half of that. I mean, they're always trying to worm and dodge out of it. And whatever good can be proven that they do is offset by the stress that they create to us. And the small business people know this better than anybody else. And we're just here to speak that we've had enough. I mean, we can't be pushed any further. I mean, we are literally losing our businesses, our livelihoods.
What's your vision of a single-payer health system?
It's very simple. It's like Medicare. My mom has Medicare. She's been happy with it. My father-in-law had it. He's passed on now. He was happy with it. He also had the VA, which is another government-run program. He was happy with that. My mother-in-law, she passed on, but she had it. She was happy with that. The argument from the insurance companies, and they say this all the time, and I hear it, it's like, you got to be kidding me, man. You don't want a government official coming between you and the doctor. But what we have now is an insurance person coming between us and the doctors. The doctor has to clear everything through the insurance bureaucrats. Right. Every time we have these problems, we've got to get on the phone, talk to someone who could care less, and they make their money based on denial and shaking us down or wearing us out. And they do that to us when we're sick or we've recovered, you know, from whatever. Now we've got these bills to deal with. But they also do it to people that are sick.
Okay, if you pick a plan that doesn't cover very much, has really high deductibles, and then you get really sick, you're going to be on the hook for all that money.
Right, but you didn't know that going in.
Yeah, you didn't know that going in?
And if you're a small business person, and it happens to one of your employees, they're going to come running to you like, why did you pick this plan? And next thing you know, you got a little internal squabble in your business.
Right.
And you didn't go into business to do that. If we had single payer, none of these issues would even exist. But there's a groundswell out here. The media's not talking about it. But it's a tsunami, and it's coming. Hopefully it'll come this year. We don't have that much time, but it's coming.